So I'm going to start you off with my first patient who we started the journey on computer generated and guided surgery, and he has given consent for his facial photograph to be shown today. He obviously has new teeth as a result of this, and this was a removable appliance on a bar, and Andrew Flood was the prosthodontist involved. But what makes his case more unique is that is all fixed in a new part of his mandible. And that mandible is actually now a neo-mandible constructed from his fibula, so one of the two bones in his lower leg. And the planning for this, as you can see, that's his pre-morbid occlusion. Admittedly, only on 2 teeth, but it's still nice if you've got only 2 teeth left in your mandible that they meet in the space where you want them to be. And what's allowed us to do a reconstruction whereby his occlusion is being maintained, his facial form is being maintained, and he still has an acceptable positioning for implants has been the use of computer-guided work. And so this is done. Materialise is a Belgium company, and it's from within Materialise that they planned with ProPlan. And this started off with, first of all, a full medical CT, and his pathology was an ameloblastoma, and from that you can plan where the resection is, highlighted in red, and then the fibula from the leg bone, the thinner of the 2 leg bones obviously, where it needs to fit. And this sort of procedure is most relevant where you've got to get 2 bits of bone to fit together well. And then from that, the customised milled titanium plate that is custom made for him, and it fits specifically both where his mandible was and also in the neo-mandible where the fibula is as well.